Hello everyone. Today I'm going to be going over a bit of a setup and demo for the new Floline veterinary blood pressure monitor. This one is specifically called the Vet BP Pro. It is kind of brand new to the website and it's like a desktop blood pressure monitoring. So it kind of, you can have it in your consult room, hospital, surgery, you can kind of move it around wherever, and it kind of can set up on a desktop, and it has a really small kind of footprint, so it doesn't take up a huge amount of space, but it's very kind of effective and fast and perfect for kind of GP and specialty clinics. So let's get started. So it comes in this very nice compact box. I'm just going to do a bit of an unboxing for you so you can see everything that you get when it arrives. So your monitor will come with a bunch of cuffs. These cuffs are specifically reusable cuffs. You'll notice that some blood pressure cuffs that come with machines aren't actually reusable. They're a disposable after first use. So these are all reusable, so you can use them over and over again. These we find are a lot more durable. They're a little bit kind of thicker fabric, so they last a lot longer. And because they're that dark fabric as well, they don't look very used straight away. We've got our connection cable. So you connect from your blood pressure to your cuff with your big grey cable. Got more cuffs, so there's cuffs for every single size, and then we've got our battery pack in here as well. Now I just wanted to show you all the equipment that it comes with. So you've got all of your blood pressure cuffs, your power attachment, and your cuff to machine cord. I'm just going to plug this in and then we can do a test run. I actually just want to show you a really cool feature. It's probably my favorite feature of this machine. So in the back, it's actually got a like handy storage area where you can actually store all of your cuffs, which I absolutely love, because the worst thing is when you're trying to do a blood pressure and then you need to change the cuff and you can't find them anywhere. You can actually just store these in the machine and then you can move it around the clinic and everything is all together. I absolutely love that. This is kind of the base of the machine as well. I just wanted to show you it's got these nice soft feet as well, so it's not going to get scratched or damage your treatment tables or anything like that. So I'm plugging my power cable just into the power on the side here. Nice. The machine actually has a rechargeable battery, so I don't actually have to have the power plugged in all the times, and I've got full battery here I can see, so I'm going to leave that cord unattached at the moment, and I'm going to attach the cuff tubing. So this is pretty cool as well. It actually attaches into the back of the machine in its handy storage compartment, just in that little hole in here. So I'm going to get the pointier end, which is a little bit narrower, and kind of plug that in there. Just kind of slides in nice and fit in there, and then you're going to pull the tubing so that it sits out the bottom, because it's got this little kind of insert here. So and you can also store this cord in here when you're not using it as well, so you can kind of store everything you need for it within itself, which is pretty cool. So that's all attached now. Turn it around. So sorry about the glare in here. I've got heaps of lighting, so it's nice lighting, but it also is not great for the reflection of the machine. Now I'm going to attach my blood pressure cuff to my tubing. So all we do here is pull back on your silver component. So we're going to pull back on that, insert the white into the hole, and let that then grab onto the white again. So pulling back on the silver, inserting the white, and letting that grab on, and now that's nicely firmly attached. If that isn't kind of sitting in properly and it's kind of a little bit loose or it's not attached properly, you won't get a proper blood pressure reading and you might get an error, and it's not going to give you a proper accurate reading. So always make sure that that is attached. Now that is all ready to go, all plugged in. So now I'm going to turn the monitor on. So you're just holding this big yellow on button for about 3 seconds, and then the loading screen should show up for Floline. If we're looking at the main kind of menu to start off with over here, it's got your cat or small, medium and large, like sized patients. So make sure that you're definitely choosing the accurate one for that. And then we've got a couple of options down here. This little one, it looks like a book with a pen. If we select that one, that is actually goes to like our file, like our documents of previous patients. So if you select file here, it will actually show you previous patients and recordings. So I've got Daphne in here. So if I select her and then I go view, it's going to show me up like the previous kind of readings for her. So you can kind of track previous patients and kind of go back and look at them if you've done a series of blood pressures. If we go back to the main menu again, we wanted to add in a new patient, you can click this little human shape person here and it will come up here to new, and then I can enter in a new kind of patient with this one. So let's say I'm going to do Bob. That will be my next patient. Category, he's a small, middle, large. He is a small. And then it's just got like kind of brightness and a couple of other settings. So let's go back from there. So that's in there ready to go. If I go back to the menu again, now it's got my ID up here as Bob. So that's the patient that I would be looking at next. If we wanted to have a look at this, it's kind of like a settings option. Just so like that has just kind of got all of our alarms set up and kind of the parameters that we've set for our blood pressure highs and lows. So you can go alarm setup and you can adjust these if you'd like. Your vet might have different preferences depending on different kind of, say, pre-meds that you might be using, so different highs and different lows. If not, I would just leave them as is. Non-invasive blood pressure setup. So we've got our intervals. So depending if you want it to set it up so it automatically kind of measures every kind of 1, 2, 3, anywhere that you choose. You could set it to every 5 minutes if you wanted, or you can just do it manually and you just have to press the button to make it start measuring. So you can change it in that setting. You can change the unit as well if you wanted. Let's go back from there. You can also, instead of, it is a touch screen, but you can also kind of toggle through the menu with these 2 buttons. So let's go back. Let's go back to the menu again. You can change your date. I noticed that the time and details on the machine are incorrect, so you could go through and edit those if you wanted. System setup, so that's that patient there again. So there's a couple of different ways you can get to each page. You can also do your Wi-Fi setup as well. If you wanted to look at your previous records, you just use this M over here, and it takes you to file. So there's all of your previous patients there. System, so it gives you details about your machine as well and kind of how much free space you've got. So if you have too many patients kind of banking up in there, you might run out of storage. So then you can check this and go, okay, go to them, and you can go through and kind of delete them, or you can transfer them via USB, and you can kind of save them to your patient file, which is a great kind of resource to have. Another final kind of buttons here that you've got is this one. It's kind of got like a nighttime versus daytime, and all that does is change your screen from a lighter, so like a brighter screen, to a bit more subtle. So it kind of puts it in like a sleep mode, or you could use it if you're using it in a dark room. So it's brighter, off, on. So if you feel like someone's knocked that and it looks a little bit dark and you go, oh my gosh, the screen's broken, just make sure that you've checked that might be the problem. Now we're going to actually test the blood pressure, and I'm going to test it on Daphne here, little angel. Now I've gone with a cuff size 2 for her, so when I'm attaching it, I'm just making sure that the arrow is lining up, that's coming away from the patient, and the index line is matching up on the inner of this index line. So when I wrap it around, it does kind of fit in there nice and snug within that line. I'm going to wrap that on. That okay? Angel, good girl. So that is all connected, and I'm going to turn on our blood pressure. I'm going to double check that my settings are correct before I... I'm going to select the medium size or small dog patient for her and just see how that goes. See how our reading goes. I might change to the smaller one if need, because she does have quite a small cuff on. And to start this, I am just going to press the big yellow button, and you can start to hear it measuring already. And that is blowing up on her foot. Let's see how we go. Velma is a little bit bigger patient, but I thought I would try her as well. So I'm putting her on the medium setting. And away we go. Good girl! I know it feels weird. Cool. Well done. Good girl. It's quick, effective, and fast. These monitors are available at Vet One now. They take up such a tiny space on your desktop. They're nice and light, and they are perfect for every single room in the vet clinic.